And I'm going to turn it over to Michael.
Hello, I'm Michael Schenkel. I work with the Bureau for Public Health and the Division of Health Promotion and Chronic Disease Prevention. I'm actually going to say next slide right now, and we're going to move on into it. I'm going to give you a quick rundown of budget do's and don'ts. And this is real important to talk about now, especially going into your planning phase. You understand what we look for when we're looking at some of these. I'm going to keep it general. This is not going to be very specific. That's why there are generally approved and generally not approved items. There are no hard and fast rules that apply to everything. So I'm going to try to give you some of the most common mistakes that we see. Next slide. Next slide. Okay, so everybody has this plan and all plans require a budget. So when you're writing your budget, we need you to be specific. Make sure you know what your end goal is for each line item. List your in-kind contributions. Now, especially with these community organizations and capacity building grants, we see lots of times where people don't list their in-kind contributions. So we do not understand that you need $500 to complete a project because you've got $1,500 donated, or somebody's bringing a backhoe and going to do all the work and all you need is the pavement. We don't understand that. So without seeing those in-kind contributions, it creates questions. So make sure you list them. Also, make sure your budget matches your work plan. If you're saying that you're going to hire this person to come in and teach this class and they've got a special certification, if it's not in your budget, it should be listed as in-kind contribution somewhere. So make sure it matches. And make sure your reviewers understand what you're wanting the money for. Oftentimes you'll tell us all about this project, but won't really tell us where the money's going and exactly what you're wanting it for. Next slide. So don't assume the reviewers know anything. And when I say don't assume the reviewers know anything, don't assume that they know anything about your organization. Don't assume that they know anything about the county, the city, the population you're working with. In general, imagine you're talking to an elementary schooler that has no knowledge of what you do. And I say that because we want you to use simple language. We want you to explain what you're doing. When you start making assumptions, for example, there are a lot of really great community organizations in West Virginia. I am not a West Virginia native. I am a transplant. I've been here, I'm going on my second year. I love West Virginia. I'm an Appalachian boy at heart, so it just touches me. But if you just expect to have the name of your organization on the application and me know what you're about, that's not going to happen. So that's a very common mistake, is people assume that the reviewers know things. List contractors as personnel. Do not list contractors as personnel. And what I mean by that is a lot of these small capacity building grants do not allow for personnel costs. But we have no problem a lot of times paying for somebody that has a special certification to come teach a class. They're not already a member of your organization. They're somebody you're having to hire for this activity. They are not personnel. They're a contractor. Personnel is people that already work for your organization. So make sure you keep that separated. One's okay, one's oftentimes not okay. So we need to understand the difference. And if you're wanting to pay somebody else for these smaller grants, we need to understand why that person needs money or why you need to spend it on that person. Don't take the easy road and group a bunch of stuff And what I mean is marketing materials. If you put down marketing materials and you put $1,500 for marketing materials, people are going to have a problem with that. When you say marketing materials, and this is an example, I want you to take this to heart with all of your line items. Tell us, I want TV advertising, and I've got this rate quoted from this person. Let us see where the money is going, because if it's grouped together, it's more likely to be no. Because as a reviewer, 90 times out of 100, if we don't understand where the money is going, it's going to be no. Don't just put gift cards. There's normally a better way to fund. And I'm going to get to that a little bit more. Next slide. So generally approved items. These are educational materials, incentives for class participation, for class participants within reason. Transportation vouchers, grocery stores, scales, blood pressure cuffs, childcare vouchers, supplies such as printer, ink, and paper. All of these are generally approved. So you notice transportation vouchers and incentives for class participation are there, but what they aren't is they aren't gift cards. So you have people that you want to help get somewhere. You can give them transportation vouchers all day long. Typically not going to be a problem. However, don't tell me you're giving somebody a gift card to help with transportation. Take that extra step and get the voucher for a specific transportation type. Next slide. Not approved items, gift cards, number one. And I say that and I harp on it because it happens a lot. Now, there are certain times in certain grants where gift cards might fly. Generally speaking, no. Like if somebody asks me just off the cuff, hey, can we buy gift cards? Can we use gift cards? No, I mean, unless you've got some very specific reason, there's normally a better way to do it. Unspecified materials. Once again, be specific. Anything that does not match the work plan, these are typically not approved. And what I mean is if you say that you're going to do radio marketing and that's what's in your work plan, and then we get to your budget and your marketing includes print media, well, why is it not in the work plan? Make sure they match. Excessively priced items. Now, typically we're not going to just say no, but if you put down you need $3,000 for one laptop, we've all been to Best Buy. I mean, you go through Walmart. If you need a specific laptop to run a specific program, okay, maybe. And I'm speaking in generalities. I am not a reviewer on this particular funding source. That's why I am talking about these generalities. Be specific, make sure that it's reasonable. And generally speaking, make sure that reviewers understand. The number one problem is reviewers do not understand A, what you need the money for, or B, what you're using it for. Next slide. Remember, be specific. Don't assume the reviewers know anything other than what you tell them. Make sure your plan matches your budget. That's pretty much writing your budget in a nutshell. If you do that, no one's going to have a problem that you have an extra page attached to it. Saves us time from asking you questions later if we like your plan. Thank you. I think I will turn it over to Regina now.
Good afternoon, everyone. Marshall University Division of Community Health is pleased to announce that we have multiple funding opportunities that will range between $3,000 and $6,000 to reduce health disparities in West Virginia by reducing the prevalence of diabetes and cardiovascular disease through the chronic disease prevention and self-management education programs. We have 2 program areas that we're specifically focusing on this round. And one will be on diabetes self-management education and support programs. The second will be self-measured blood pressure self-management programs. Next slide. We'll have 3 $3,000 awards that will increase access to participation in diabetes self-management education, DSMES programs for healthcare systems only. We will have 5 $5,000 awards to healthcare systems only to improve cardiovascular health and increasing access to self-measured blood pressure monitoring programs. And then we'll also have $5,000 to $6,000 awards given to community-based organizations to improve cardiovascular health by increasing access to self-measured blood pressure monitoring programs.
Good afternoon, everyone. My name is Regina Knox. I'm a health educator with Marshall University Division of Chronic Disease and the School of Medicine. And I'll be reviewing the deliverables for each of the 3 programs. And this is going to be a brief overview. The funding opportunity will be available on WB Health Connections sometime early next week. So we will open up that application for you to apply. And then we'll talk a little bit about when the application will be due. So the deliverables for the first opportunity, that's the DSMES, the Diabetes Self-Management Education and Support Services, is only for healthcare systems. And the amount for this funding is $3,000. We will have 5 awardees. We're asking that you have a minimum of 20 program participants in your DSMES program. This is for current DSMES programs to expand to another location. So if this is not for new programs, it's for existing DSMES programs who are looking to expand. So we ask that you have a minimum of 20 participants by the end of the program. We ask that you have a minimum of 2 staff members complete training. All of our trainings will be 30 minutes. We ask that you do at least 1 hour. So that's 2 trainings. We will have a learning management software system that we are a partner with WVU OSHR. WV Health Connections will be working with us on that learning software system, so you can log in at your convenience and complete those modules. We will ask you to develop a referral system for the new location. So if you already have an existing location, we want you to develop a new or expand your existing referral system to that new location so you can recruit participants, patients into that program. We're asking you to participate in quarterly meetings and submit quarterly progress reports. The quarterly meetings and quarterly progress reports will be a requirement for all of the different funding opportunities. The next opportunity is for the SMBP program, the Self-Measured Blood Pressure Monitoring Program. This opportunity is only for community-based organizations. If you're a coalition or basically if you're anyone except the healthcare system, you want to do some type of self-measured monitored blood pressure program for your organization for the community members. Pretty much the same requirements. We're going to actually have 2 staff members complete at least 1 hour of training. We're going to ask that you develop a referral system. We're going to ask you to participate in quarterly meetings, submit quarterly progress reports. And we're going to ask that you implement an evidence-based SMBP program with a minimum of 25 participants. Some of the application, if you have questions, because of the brevity of today's session, you can type them in the chat box and we'll answer all questions from the chat box in the order that they're received. Or if we have time, we'll answer your questions verbally. So I saw you, David, with your hand up. So I'm going to come back to you. So for the application components, all of the applications have the same requirements. We're going to ask for a cover page, which is attached to the application, a project proposal, which should be less than 5 pages. So we're not talking about a large amount of money. These programs are typically things you can do on an ongoing basis. There are lots of models for them. You can create your own program from an existing evidence-based model. So less than 5-page proposal. and a project budget form, which we do have a form where you can complete, where you would specify what you intend to use the money on. Michael gave a great overview of generally accepted budget items and things that generally won't be accepted. If you have any questions about any line items, you can absolutely send us an email inquiring about what's accepted, what's not accepted. The due date for this is going to be November the 15th. The project implementation period is going to be a quick turnaround. It's going to be December 1st to June 29th. So we're looking at 7 to 6 months for implementation. And Sheila, I think I did one of your slides. I can't hear you, you're on mute.
Oh, sorry. Yes, that was the one that you just did. That's okay.
I'm sorry about that. So now we're going to transition to our partner, WV Health Connection, to talk a little bit about the resources available.
Thanks so much, Regina. Yeah, well, first off, it's so great to be with you all today and just to chat about this awesome opportunity. Samantha and I were part of the West Virginia University Office of Health Services Research. We've crossed paths with many of you all, but for some of you, might be the first time we're meeting. So it's, yeah, we're happy to take any questions after we share a few of the slides we do. But yeah, Regina mentioned WV Health Connection, which is an initiative that our office supports. And so Samantha and I are just going to talk a little bit about how that initiative could be supportive to this kind of work as well. But yeah, you'll see on this slide, visualizing data. So this is one tangible way that we support partners. Most of the work our partners do is amazing community or clinic programs, and often there's a need to communicate the impact of the work that folks do. So we do that in a variety of ways. You'll see here things like infographics, data briefs, mapping, any kind of reporting and graphs can be helpful to showing data in a way that communicates what's been going on. And go to the next slide. A little bit more context about WV Health Connection. This initiative has been going for 4 years but it's been, I guess, created to address needs that partners in the state have noticed related to having a coordinated way to communicate with other partners who are doing similar work, having a way to securely share data across different partners and organizations, all with the goal to best serve the state and help promote health and manage chronic diseases. So yeah, you can go ahead, Regina, thanks. A lot of those partners too for Health Connection, some of those folks are on the line currently. We work really closely with the folks at Marshall, of course, and then also our partners at the Bureau for Public Health, who've been huge supporters of this work for many years. And yeah, I mean, I guess the idea is that the more integrated different organizations are, the better the chance to improve health outcomes in the state. So what I mean when I say that is groups like, health systems, universities, community organizations, families and individuals, all being able to be, well coordinated, developing referral systems to resources and opportunities for folks, having data that shows how things are going for folks who are involved in those programs, and just keeping everyone in the loop about how things are going. So that's what this model is explaining here. And there's many other pieces to it as well. I mean, you'll see things like health equity and training listed along the outside, both of which need to be priorities to best support, I guess, the expertise and efficacy of what happens within the model. So those things help provide better services to folks in communities. Yeah, so we can go ahead to the next slide. So I guess where our office steps in to help support that idea of being well connected in the state is providing software and helping think through ways to share data across organizations. So we provide a HIPAA compliant software among other kinds of software that help with data tracking and reporting, help to support referrals between different groups. And we also have a public website that showcases the availability of community and clinic programs. Also things to display resources groups want to show as well. We can move ahead. Thanks so much. Great. And then I'll take this slide and I'll turn it over to Samantha. Just an idea of how, I guess, what our partners are engaged in addressing throughout the state. So many chronic diseases, there's programs designed to prevent them or manage them, and that's a lot of the work our partners do. So things like obesity, diabetes, prediabetes, you see the list here. And this is an ever-growing list as well. So we're not limited to any set number of chronic conditions. As long as partners are interested in promoting health and wellness throughout the state, we're always open to partnering.
Yeah, thanks so much, Audrey. Hi, Samantha Shawley-Brzozka. And like Audrey mentioned, we've been heading up this work for a while, and, it's just growing dramatically. And, if you have any additional programs that aren't on this list, we're happy to, take some guidance along the way as you implement them and see if they're a good fit for the software that we have. But I know today's focus is really on the 2 programs for these funding announcements, but we wanted you to at least see where our reach is currently. A lot of these programs are grouped into areas like food prescription programs. There's a lot of different types of programs out there, as well as physical activity. It's very limited in terms of the viewpoint, but it can be any type of program that you have that you're running that has any outcomes attached to it. So like participation numbers, health outcomes, survey data, anything like that. So go ahead, Regina, to the next slide, and I'll try to wrap this up so we have a couple minutes left. This is a TA that we offer. There's 2 slides on this. I won't belabor all of the text that's here, but ideally we can help you build your program, connect with others in the community, help with changing your format to virtual if it's been in person for a while. I know the folks at Marshall have done a great job trying that out as well with their partners. We can help you get connected with more formal training. And then also, if it is a CDC or other type of organization that's running that program, we can help you become recognized or at least on the list in terms of offering that program. There's lots of standards that go along with these programs that are really complicated, and we try to streamline that to help you implement even easier. So your job is really offering the program, not all of the crazy things that go with it. So go ahead, Regina, to the next slide. The other piece is really around data tracking. Audrey had mentioned a lot around data. It does not have to be super complicated. It does not have to be a healthcare system with an electronic health record system. It could be as simple as an Excel sheet or paper forms that you're tracking data on. What we try to do is bring all of that data together to show that your program is actually feasible, effective, and sustainable within the community. We do a lot around collaborating with others. So we do have a mechanism to share data with other groups that you need to share it with, whether that's a funder, a local collaborator, or just internally that you want to show your results. So go ahead to the next slide. And as always, just thanking the Bureau for Public Health, who was recently speaking, as well as the Benedum Foundation and an informatics group throughout DC. And then the last slide we have is our contact information. So if you want to get started early outside of the application, our Gmail is located there, as well as our web link and Facebook. So thanks.
Samantha, Audrey, and Michael. And now we will open up the floor. We have about 5 minutes for questions, and there was one question in the chat box from David. He asked about the funding opportunity for community-based organizations. That was SMBP. So there are 2 separate funding opportunities for SMBP, one for healthcare systems and one for community-based organizations. So out of the 3, there's DSMES only for healthcare systems, 2 SMBP programs, one for community-based organizations and one for healthcare systems. And do we have any other questions? Any other questions? So you can unmute your lines at this time, or you can type your question into the chat box. Now I'm going to put Sheila's email address and my email address in the chat box if you have any questions after today's webinar. Yes, so Well, Rachel, because I have your email address, but we didn't really do like a registration for this webinar. Some people just got a link. So if we have your email address and you want it, we can send you today's slides. Yes.
Or you could send us an email and just request.
Yes, that would be better.
That way. Okay, that would help.
And once again, today's webinar is being recorded. So we can send you the recording after the session today if you shoot us an email that you would like the slides of the recording. Any other questions?
Hey, Regina, David asks, when and where is the application going to be released?
Good question. So the application should be available sometime next week on WV Health Connections website. So it will be submitted electronically through WV Health Connection. And there's other capacity building grants available on WV Health Connection as well. So we will put their email, their website in, thank you so much, in the chat box.
Yeah, I guess with that said, Regina, you'll have a direct link to your application to send out at a later date as well. I know that they're finishing up the more formal application portal for it. So I know we're ready to go as soon as we have that official application on our end. So, and we'll be able to share that out. And I think you could probably share out the slides ahead of time, Regina, if you want, and then we could just maybe follow up that email with the official web link. If that's okay.
Absolutely. We also have the electronic.
Are we live? Are we unmuted?
You are, sir.
Oh, okay, thank you. Thank you all so much for this. That's Dewey Houck in Wyoming County. We really appreciate all this good information. It helps us get a good start on what's happening. Can we apply for more than one of these grants?
Dewey, you guys are just a community-based organization, so you could only apply for the one.
I will say though, if you go to Health Connection under HPCD grants, there are more organizations that are offering grants, and it'll tell you kind of what areas they're focused on. So I'm not familiar with your organization, so there may be others there that you can qualify for.
Thanks.
Yeah.
Yeah, Dewey, I would be happy to email you some of those web links that Michael mentioned. Just want to say hi. It's great to be here with you, and we can send that info your way.
Anyone have any other questions you like to put in the chat box or ask verbally?
So I know you said you're going to send these out, and I apologize to ask this again. I'm maybe need some more coffee, a little slow, but there's two, as a community group, can apply for the blood pressure monitoring and whatever the third option was, and I didn't get it down, for community education. Those were the two that a community group could apply for or not? And when I put up the website, looking on the HPCD grants, does this one fall under, I see the Active and Center for Mountains of Hope, but does this one fall under any of those particularly?
Not necessarily. To the funding application for these opportunities is not available yet. So this is kind of like a pre-application webinar.
Okay,
It
I got
will
you.
be available as soon as next week. And then for this funding, even though there's 3 separate funding opportunities, there's only one opportunity that a community-based organization can apply to, and that's the self-measured blood pressure monitoring program.
Oh, for just the blood pressure monitoring. Okay.
So the DSMES is a more structured program for clinical providers. So community-based organizations would not be eligible to apply for that one. So at this time, it's only the self-measured blood pressure monitoring program.
Okay. Thank you.
You're welcome. And if we don't have any other questions or anything else in the chat box, we are at our 30-minute time mark. We appreciate your patience, your consideration for joining us today. Once again, you can always email Sheila or I if you want the slides or the recording, and we thank you for joining us, and you have a wonderful afternoon.
Thanks,
Thank
guys.
you.
Thanks so much, all. Thanks, Regina.
Thank you. Bye, Audrey.
Thanks.
I didn't realize I was unmuted the whole time. I hope you didn't hear my dog's nails clicking on the floor.
I
No.
You're